I don't. I don't know that. I'm worried about the roommate and the ex.
Why? Tell me.
Well, I introduced them, and now they kind of like are hanging out a lot, and not with me there. So it kind of makes me worried that maybe they're, I don't know, they're talking bad about me or something. And I don't. And it's kind of hard too because I had these feelings for my roommate, and I mean, I guess that's kind of run its course. But I mean, I don't know. It's a lot of crap going on there.
Oh wow. Well, so what I'm hearing you say is that um, you introduced your roommate to your ex,
Yeah.
and uh, and because of that, they started hanging out.
Yeah, they became friends.
They became friends. Okay. Well, why did you introduce them in the first place?
I mean, they're both in my life, and I don't know.
Okay. All right. So if you introduce them, um, why is it such a um, unnatural thing that they would want to hang out together?
Well, I introduced them. They should want to have me there.
Okay. All right. So do you think that that's something that you can control though?
I don't know.
You don't know? Okay. So when you were in treatment and they talked about, do you know the Serenity Prayer?
No.
You were in treatment. You went to drug and alcohol treatment, right?
Right.
They didn't tell you about the Serenity
No,
Prayer.
they did it. I don't really remember all of it.
Okay. Well, so in the Serenity Prayer, they talk about things that you have control over, things that you don't have control over, and knowing the difference between those, right?
Right.
So with that, um, we have control over ourselves, like what we do. Like you had control over introducing your ex and your roommate. Beyond that, do we really have control over what other people do or say?
No.
No, right?
Right.
So it sounds to me like you possibly are trying to control some stuff that you have no control over. Does that make sense?
Yeah, I guess it does.
Okay. All right. Well, I think that would be helpful for you moving forward. But also, something you may want to talk to them about. I'm getting the sense like you kind of feeling scared about that.
Well, yeah, I am.
Okay. All right. Well, um, so you're telling me that you're also using with your ex, um, and when you were in treatment and you were about to leave treatment, what um, what were some of the suggestions that they gave you about about what you should do when you leave?
I don't really remember.
You don't remember? Okay. Um, like, did they tell you that you should go to meetings?
Well, yeah. I mean, they said that was important.
Okay, all right. And did you go to any meetings?
I mean, I did for a while.
Were they helpful?
I mean, I guess.
You guess.
Yeah.
Um, what about people, places, and things? Did they say anything about people, places, and things?
I guess they did. I don't know.
Well, what do you remember that them saying about, like, who should you be hanging out with when you get out of treatment? Like, what kind of people should you hang out with after you get out of a drug and alcohol treatment program?
I mean,
You don't know?
no, I don't
Okay.
know.
So do you think it's a good idea that you hang out with people who are using drugs?
I mean, I guess not
No, right? Why do you think that would be difficult for you?
because I probably want to use too.
Yeah, absolutely. So, so I know that can probably be hard when you want to hang out with your ex, but he's also using drugs that you have made a decision that you don't want to do, right?
Right.
Okay. So, um, so where do you think that you can go in order to maybe make some new friends with people who aren't using drugs?
I guess maybe a meeting. I don't know.
Okay, all right. Well, that's a good suggestion. Um, do you have any? Have you? When was the last time that you went to a meeting?
Oh, a couple weeks ago.
A couple weeks ago.
Yeah.
Okay. Do you have a sponsor?
No.
No. Okay. That may be something that you want to change. Um, Now you're wanting to go inpatient. You're wanting to go to a hospital. Would you want to go back to this Gaudenzia place?
I mean, yeah. I mean, I really liked it. It
Okay.
really, I really fit there. I feel
Okay. Well, it seems to me like when you got out of there, that you started to hang out with your ex again, and you started using again. Was
like.
that accurate?
Yeah.
Okay. So, what do you think that you're gonna need to do in order to get out to not do that? What do you need to do instead?
I guess I need to not hang out with my ex.
Okay, but that could be hard though, right?
Right.
Okay, so um, so another thing that I'm thinking about, we have already said that you want to stop using. Um, so as far as like other goals, um, I'm just thinking about like beyond not using, like what you want to get out of life. Okay,
Okay.
so I'm gonna ask you a question, and it's gonna sound a little off the wall, but just bear with me, okay?
Okay.
All right. So say you fell asleep right now, all right,
Okay.
and all of your problems in the entire world just went away,
Okay.
all right, and you wake up and all of your problems have disappeared. So, what would be the first thing that would tell you that your life is different?
I don't know.
You don't know? Okay, well let's sit with this for a minute. So you open your eyes, and how do you feel inside?
Um, I don't know. I guess maybe happy.
Happy? Okay, and that's a good emotion. So, what does happy look like for you? What would how would you know that you were happy?
I'd probably be smiling.
Okay, all right, that's good. That's good. So let's stay in this room. Let's stay there, and let's look around the room. And what would you notice that would be in the room, to let you know that all of your problems have gone away?
Absolutely anything. I mean, like a thing or a person or
Yeah. First thing that comes to your head about something that you would know that all of your problems have gone away.
probably if my roommate was there.
Your roommate.
Yeah.
Okay. So I'm noticing that you're saying your roommate and not your ex. So I guess your roommate means a lot to you.
Yeah. That's definitely true.
Okay. And probably like if all your problems went away, um, that would mean that he wouldn't be mad at you.
That's true.
Okay. All right. Well, that's good. Um, would there be anything else that you would notice um, about yourself or anything that would be different?
I don't know. Not that I can think of.
Okay. Well, I'm thinking about one big thing that I feel like would be different.
Okay. What?
Well, I don't think you would be in this hospital,
I guess that's true.
right? Okay. Well, Mark, I am going to go and I'm going to get some resources for you. So, When you get out of wherever you're going, I can't guarantee that you're gonna go to Gaudenzia, but I'm gonna definitely tell the nurses that that's where you would like to go. Um, I'm gonna give you some meeting resources that are in this area that I feel like you would really connect with. Okay.
Okay.
All right. I'll be back.
All right.
Do you want anything? Can I get you any ginger ale?
No, I'm okay.
You're okay?
Yeah.
Okay. I'll be back. Ow, ow, ow. You're doing great. All right. Hi, Mark.
Hi.
Okay. So I let the nurses know that you want to go to Gaudenzia. Um, One thing that's really on your side is you do have Pennsylvania insurance. So I believe that they are going to put in information to get you over to Gaudenzia. So that's a good positive.
Okay.
So while I was out there, I found 4 LGBT AA meetings, which are okay.
Okay.
So I wrote them down for you, and also I wrote down their addresses, and also the website of the area, because I know that you had told me before that you have problems driving. You're not driving right now, right?
No.
Okay. So if you ever need a ride to a meeting, you can call this number and they could schedule somebody to come pick you up and bring you to a meeting. Okay.
Okay.
All right. So here are these meetings, and also I think it would be a good idea to possibly call that number as soon as possible, in order to let them know that you would be getting out of treatment at some point soon. Okay?
Okay.
Okay. So, is there anything that I can do for you right now?
Not right now.
No?
No.
Okay. Well, I do want to thank you so much for your time. And if you have any further questions, I'm just right outside in that behind that desk. Okay.
Okay.
All right. Well, thank you.